going to hit you with a shocking statistic. In 2024, we estimate that there will be 310,000 new cases of invasive ductal carcinoma, of invasive breast cancer. These numbers are astounding. They are up from what we saw almost the entirety of the beginning of my career, which was in and around 240,000 cases every year. So, we're talking about 70,000 more cases of invasive breast cancer. I can give some reasons why I think that is the case, but no matter what they are, the fact is that we have an epidemic on our hands, and we are in crisis in the way that we are diagnosing breast cancer, and certainly in the way that we are treating it. So I brought you an expert today to talk all about this, to talk about how we are treating breast cancer, and honestly, how we can bridge the gap between conventional medicine and integrative oncology, because it is more important than ever that we do that. So I'm going to welcome Dr. Lucas Times into the show. Thank you so much for being here. I am so delighted to have you. I'm just going to give people a little background to see how important and special you are. So you were the medical director both for City of Hope and for the Reardon Clinic. You have an enormous amount and breadth of experience in this integrative oncology space. And I'm just so delighted to have you here to share your wisdom with us.
Thanks, Dr. Simmons, for inviting me and for the nice, kind words. The respect is obviously very mutual for everything you do and your expertise. And yeah, we've been lucky enough to connect a few times and have some good conversations around some of the neat stuff you're doing. And so excited to talk today and hopefully get into some meaningful discussion around, like you said, this cancer epidemic that we're seeing, not only breast cancer, but really all types of cancer.
Yeah. So I know that you really deal with all types of cancer. I am very familiar, obviously, with the breast cancer statistics. Are you seeing those kinds of alarming statistics across the board in terms of cancer?
You know, what I'm seeing that I think is most alarming in the last 5 years is not only the incidence is going up. And I mean, you really only can tell that by looking at the data and the research that's out there. But in terms of my bubble that I live in and work with patients, what I'm seeing most alarming is the age, really. And, I think it's fair to call it what it is. I mean, at this point, cancer is no longer a disease of the elderly. Mm-hmm. This is no longer a disease of the middle-aged. I have women with breast cancer in their early 20s, late 20s, early 30s, barely adults. And this was something that 10 years ago, maybe once in a blue moon. But now it's becoming just as common as seeing the 60-year-old with cancer.
I always say that, when I was in practice as a breast surgeon, if someone called me, I have an 18-year-old in my office, she has a lump in her breast, will you see her? And I would say, I'm 100% certain that it's going to be nothing, but send her over. Of course, I'll see her, right?
Sure.
I can't say that anymore. I can't say that anymore with any confidence, because we are having teenagers diagnosed with breast cancer. It is unheard of. When I trained, it was unheard of. Right. And yet now there's no one out there in the cancer space who hasn't had one of these. No one.
No. And it's, you're seeing the reports, you're seeing the research, every other day. I'm always scouring and looking for new journal articles to read and trying to understand better what's going on. But it took a while, but now it's every day there's headlines about this. Yeah. And so mainstream media, I think everybody, unless you've had your head under a rock, everyone knows that this is happening. Okay. Where we're caught right now is we've got the awareness, which is building, which is great, but what are we going to do about it?
Yeah.
what are we going to do about it? And I
Yeah.
think that there's some very, bright minds and courageous people that are out there. I would include me and you in that discussion, that are realizing that this is an oh crap moment, and we can't wait for the science and everything to catch up 10, 15 years from now. We need to
Yeah.
be pushing the envelope. We need to be having these conversations and figuring it out. I
Yeah.
mean, at the end of the day, the journals and the research and the studies and the trials, it's going to be too late. The tsunami's happening.
Yes. I
And
couldn't agree with
so,
you more.
yeah,
I mean, someone reached out to me on an Instagram post this week, and they were talking about how, I'm opening a perfection imaging and we're using QT technology to screen the breast. And we were talking about the fact that they said the company started in 2012, and why is it taking so long? If it's so great and so monumental, why is it taking so long to become available and
right.
commonplace? And what people don't understand is that the mainstream medicine is 10 to 15 years behind, and it's
Yeah.
taking people like me and you to bring these technologies, which are necessary, especially in this time of crisis. They're necessary to get out there, and we can't wait for the hospitals to get on board. We can't wait for mainstream medicine to get on board.
No, they'll be the last to adopt these types of things, and that's okay. I mean, that's how these things scale. And when you look back over, the history of modern medicine, that's how it happens. And so there has to be trailblazers. There has to be people that are willing to, put themselves out there a little bit and, try some things that may be considered outside the box or non-standard of care. If we're gonna shift the paradigm, if we're gonna actually start addressing the root causes of why this tsunami of cancer is happening.
I know. I know.
And yeah,
Absolutely.
the detection part of it and the technology and all that, that's a big piece of the puzzle. And having safer, less invasive options like we've talked about with the QT imaging. But there's just a huge conversation that's happening in the integrative space about the underlying causes of cancer. And then when patients go and they have their sit downs with their conventional oncologist, there's a complete disconnect with those two things.
Yeah, absolutely. So I want to start off by talking about, what is integrative oncology? What does that mean for you? What do people need to know about this space?
Yeah. Yeah, I think it's a phrase or a term that's evolving. I think when people talked about integrative medicine or complementary alternative medicine not that long ago, it was kind of it was almost a derogatory term. It was these people are uh,
Quacks?
pushing they're quacks. Let's
Yeah.
say it. That's a word that
Yeah.
most people know. They understand that. But yeah, there was just people were looked down upon that practice any kind of integrative or complementary alternative medicine. Now, you see some real leaders in medicine that are using those terms. To me, what integrative means, what it's always meant, whether people used it this way or not, but to me, it's the best of both worlds. It is realizing that there are lots of different approaches to medicine and health and wellness that go back thousands of years, some of them, and that there's strengths and weaknesses amongst all of them. And integrative to me is, how do we integrate all the different styles and practices of medicine and healing to really boil it down to what works the best. And in my case, for cancer patients, because
Yeah.
cancer is, by far the type of disease where you do need all hands on deck and you do need to hit it from multiple angles. And so to me, the integrative approach works, it's such a great fit for cancer care because these people need to be supported from many different angles.
Yeah. And almost like necessary,
Mm,
right? Because these people are in crisis. We
yeah.
we talk about health continuums, and if you've gotten to the point where you have a cancer diagnosis, that is a failure of your health. And it's going to take a lot of coordination to restore it. And one of the biggest objections that I have to the conventional medical system, and I'm not criticizing because I spent a lot of time there and
Sure.
I did a really good, I was trained to do a job and I did a really good job at doing what I was trained to do. But the problem is the training is wrong, the thinking is wrong, right? So I'm not criticizing conventional medical doctors, except that they are, and they're doing exactly what they were trained to do. And
Yes.
they're focused on the tumor, not realizing that the tumor is the symptom of the problem.
It's
So
exactly
unless you acknowledge that there is a problem that led to the tumor and work on that, work upstream,
right.
you're not really going to change the trajectory of people's illnesses. And that is so clearly demonstrated in the breast cancer space, because you take women who get diagnosed with breast cancer, and if all they do is go through conventional therapy, they're 2 to 3 times more likely to die of cardiovascular disease than people who were not treated for breast cancer. They have increased rates of Alzheimer's, of dementia, of osteoporosis. So all of these factors that led to the breast cancer remain undisturbed in the conventional treatment paradigm.
Correct. Yeah. I mean, it's you're right about the doctors. I mean, they're doing what they're trained to do, and just like you know, people in the military are trained to sometimes kill other people, enemies, right? We don't ask them to solve the global problems that are causing war. We just ask them to fight in the war. And I think it's very similar to the way that we just, our medical system is set up for our doctors to, at least in the cancer space, to just fight cancer, kill cancer.
Right. Yeah.
And yes, that is sometimes needed. A lot of times it is, at least that approach is needed at some point in the journey. But if we're not having the conversations and trying to make peace with what's causing the cancer, to me, we're just going to get stuck in this never-ending cycle of just kill cancer, kill cancer, kill cancer. And then, not to mention, you've got these other stakeholders, the industry of medicine,
Mm-hmm.
big pharma, insurance companies, hospital systems, and their only job is to make money off of sick people. Let's be
Right.
honest.
Yes.
So there's a big conflict of interest there.
Yes.
And the
There's
doctors are
no
really,
benefit to
no,
them if people get well. None.
there really isn't. I mean, they want them to stay alive
Yeah.
because, but they make their money in the treatments. And unless someone's really sick, you can't justify giving them very expensive chemotherapy. So yeah, there's a big conflict of interest. We have
Yeah.
to somehow deal with that. I mean, I don't know, who is the right group of people to deal with that issue. It seems like it's almost suffocating, the size and the scale of it, and how much money's involved. But to me, that's
Yeah.
something
It's
that we got to figure
daunting.
out.
It's
It's
absolutely
daunting,
daunting.
very daunting, and it's very overwhelming for, individuals to think about how do we change this? Because
Yeah.
there's just so much money involved. There's so much power. There's such a power differential between the patients and the people that make money off the patients.
Yeah. I couldn't agree more. It's quite a conundrum. Um, I'm not going to solve it.
No,
I know
we just
that
got to do our little piece. Yeah, we
yeah,
got to do our
like
piece.
I'm on a mission. It's not that mission. I certainly, in the one-on-one space, help to navigate people through this system as best I can and make it clear for them what each person's intentions are, because everyone's intentions are certainly different. But I know that I'm personally not going to fix that system, but I'm going to do what I can do and help the individual. And that's really what you've spent your career doing, is helping the individual. So
Right.
take us through your approach and the kinds of things that you think are really important in helping someone navigate a cancer diagnosis.
Yeah, my approach has evolved over the years of my practice, and I've developed new tools and strategies. But it all comes down to I always go back to this analogy, which if you've watched any of my videos or podcasts, other people, they may have seen me talk on this before, but this really is what sets up the sort of chessboard for me, is looking at cancer as like a weed problem in the yard. Okay. And so patients get diagnosed with a specific type of weed. This, the conventional system does a biopsy or a blood test or whatever it is, identify you have a weed problem. This is the type of weed you have. We need to cut it out. We need to put some weed killer on it. Maybe we'll burn it a little bit too. That's kind of like the standard approach to the weed problem.
Yeah.
To me, my role is not really in killing weeds or doing anything that physically kills the weeds. It's looking at what's going on in the soil. Okay. Why are these weeds here in the first place? And let's take a sample of the soil. So we start with our testing. We start with our blood test. We start with our testing for different markers of the terrain of the soil, metabolic markers, inflammation markers. How's your immune system working? Key nutrient levels, hormones, gut health, everything that makes up the health or the disease of that soil. We need to get an idea of what we're dealing with there, because just because you have a certain type of weed, let's say you have a breast cancer weed, lots of different problems in the soil can lead to that one kind of weed.
Yeah.
It's not like it's a cookie cutter thing. Oh, you got a breast cancer weed. We know that it's a hormone problem and we just have to fix the hormones. I wish it was that simple.
Yeah. Yeah.
Unfortunately, we got to
and
take
often it's not one thing, right?
It's gosh, I mean, maybe I can count on my hand the times it was one thing, in the thousands of patients I worked with. But there sometimes can be one thing that's the biggest piece of the puzzle.
Mm-hmm.
But they're usually, what's that?
Or the trigger.
Or the trigger, or the straw that broke the camel's back, however you want to say it. But there's usually an inflection point, because at the end of the day, and I've heard you talk on this as well, I think we're in agreement, we all have potential cancer cells in our body on a daily basis, right?
Yep.
So what takes that from an issue that our body can overcome, our immune system can deal with? What's the tipping point where it becomes a threat, right? And so the human body is pretty amazing. It can deal with a lot of threats at one time. Obviously, we fight off infections all the time. We're exposed to stuff all the time that our body fights off, a lot of times without us even knowing. But you get enough insults stacked upon each other, coupled with, an unhealthy environment, which we can talk more about, and it just becomes too much for the body to handle. And I think that's what we're at with this epidemic, is we've got too many insults coming into the system on a daily basis. So going back to my process and my approach, it's all about, fleshing out what does the soil look like, and then putting in place a plan to repair the soil, strengthen the soil, so that, if you do have your weed treated and taken out, how do we set up that soil so that it's not a hospitable place for those weeds to come back? Okay. Doesn't guarantee that they're not going to, but we can absolutely stack the odds in your favor by dealing with those underlying issues.
Yeah. So we talked about that you're looking at metabolic markers, you're looking at markers of inflammation, you're looking at nutrient profiles, gut health, hormonal health. So what kinds of things are you presenting as solutions for people in that? How do people go about resetting their soil and improving that environment so as to not foster disease, but to foster health?
Yeah. And this is where it takes time, right? The cleanup of the soil is usually not a quick fix. And so by understanding what the problems are in the soil, then we have to start to understand what is creating this problem in their day-to-day life. Because, we get in the big argument of like genetics versus environment. Everything that happens in the body is your genetics meeting your environment.
Yeah.
Okay. So
they're both the marriage of the two.
They're both involved. Okay. We don't need to be having this this argument of, oh, it's genetic, or, oh, it's all diet and lifestyle. It's where those two things are meeting each other.
Mm-hmm.
Okay. And your genetics are going to make you a little more predisposed to certain environmental triggers than mine, and vice versa. And so that's where we're all unique. So to me, I need to understand, if someone comes to me and they've got very high levels of inflammation, their metabolic health is trashed, and they've got low nutrient levels that they need in order for those other things to work well. Okay, let's start repleting them with the key nutrients. Okay, let's look at what's driving the inflammation. Is it, a toxin load? Is it a chronic infection that they may have, like a stealth infection, parasites, viruses, bacteria, fungus? We find all this type of stuff in people.
And what you mean by a stealth infection is people don't necessarily feel sick, but it's causing chronic inflammation in them, right?
Usually they
Or
have
maybe
symptoms.
they do feel sick and they don't realize that that's what it is.
They just haven't gotten labeled by anybody, because it usually doesn't show up on the cursory blood work that traditional doctors are doing.
Mm-hmm.
Right? It doesn't send up those red flags that it's a big problem. It's this low level problem that's there. It's probably been there for years. And most of the time people say, I just don't feel good. I'm tired. I don't sleep well. My stomach hurts when I eat most kinds of foods. I can only eat these 3 foods. Otherwise, my stomach hurts. I've been constipated for 20 years. My joints ache, and I'm only 35. It's these types of these constellation of symptoms that, traditional medical doctors, they're like, they see these patients and they're like, oh, I got to deal with this person again. All they do is complain about these problems that I don't have a fix for.
Yeah.
So a lot of people,
they don't have the tools.
Signs of a chronic inflammation or a stealth infection.
Yeah. And I think it's important to note that it's not normal. I don't care how old you are. It's not normal to feel tired. It's not normal to have poor sleep. It's not normal to have abdominal discomfort after you eat. It's not normal for your joints to ache. It's not normal to be constipated. So if these things are happening to you, know that these are precursors. This is your body telling you, I'm not working correctly.
Exactly. And it's actually your body actually is behaving normally. Your body is sending you a signal that there's a problem, and that's what it's supposed to do. A symptom, which I'd like to talk a little bit about cancer being a symptom and not a disease. But these symptoms are signals. They're our body telling us that they're actually a normal reaction to an unhealthy environment. Okay.
Yeah.
So we have to help people understand, like you said, that when you have these symptoms, all these check engine lights are on in your dashboard. That's not the way it's supposed to be. That means we have to do a deeper dive. We have to look under the hood and figure out why you're getting these symptoms. And, our medical system, again, going back to the infrastructure, it's not set up to do that. It's set up to a pill for every ill. Mm-hmm. Here's your quick fix. Next in line, and just keep moving through.
And that's a very big problem for a lot of reasons, because you said before that, fixing the soil, it's not a quick fix. And yet we've been so trained that have a symptom, take something to eliminate the symptom. And everyone is looking for that quick turnaround. I mean, I can't tell you how many people that I've worked with that, I'm working with them for 6 months and they're like, we haven't made enough progress. And I'm saying, like, I'm trying to undo 20 years of damage, 30 years of damage, 40 years of damage. Like, that's not happening in a couple of months. And I know it's frustrating to people, but the truth is that there is no quick fix here. And people ignore these symptoms for years and years and years. Sometimes they do go to their physicians, right? But their physicians are only trained to recognize failure. They don't tell you you're diabetic until you're frankly diabetic, right?
That's right. And all of our mainstream medicine is basically built on the emergency room model, right? Yeah. That person's in there with an acute problem, and you give them something to address that. You get them out of there as soon as you can, and you get them home, and then let them find their own way back to health from there. That's all it really, and even the way we treat chronic disease, we still are kind of doing that same thing.
It's true.
And we just keep adding a bigger Band-Aid on top of every other Band-Aid,
Yeah.
Oh, that Band-Aid stopped working. Let's just put a bigger one on there. Oh, okay. That stopped working. Let's just put a bigger one on. So that's the model that's the paradigm shift. I think it's happening. I mean, more people are waking up. The demand is there. People are more educated now about integrative and alternative medicine than they've ever been. So we're getting there, but yeah, we're up against it with that model.
Yeah.
But yeah, when you're talking about cleaning up the soil with these patients, what I try to stress with them early on in the education part of it is that, yeah, we need to clean up your soil as quickly as possible, but there is a long-term responsibility to you to keep the soil clean. Okay. It's not like you do this protocol for 6 months and then you just don't have to worry about anything anymore. That's what some people, I think, that's how they think, because again, they're working in that program of acute care, clear the infection, patients get better and move on. When we're talking about cancer or other chronic diseases and you've got a serious soil problem, we need to fix the soil, but then you're going to need to tend to that soil for the rest of your life.
Yeah. Yeah. I mean, listen, we know that health is not a destination, right? Health is a journey.
Right.
And I'm going to throw my own husband under the bus, who he has, for the third time in our 21-year marriage, has lost 60 some pounds. And he's
Tremendous.
really good for a period of time. And then he kind of falls off the wagon but still preaches as if he was on the wagon. So he was talking to a mutual friend of ours, Bruce, and Bruce is like, how does Albert look so good? And I gave him Albert's whole plan, and he's out with Albert, and Albert's eating pizza or whatever he's eating. And he's like, wait a minute, this is not on the plan. And, it's a real problem for people because long-term habit change is really hard. And when you're in crisis, it's easy to kind of get there and stick to it. But as you ease your way out of crisis mode, when it doesn't feel emergent, it's hard for people. Yeah. And we need an understanding that the way we have to live in a healthful way. Yeah. We have to. That needs to be our baseline. If every now and again we slip up, that's okay. But it's what we do most that matters, and we need to maintain that throughout our
80-20.
lives.
80-20 rule I tell people all the time is, I mean, you may be stricter in the beginning when we really need to get a shift happening.
Yes.
But long term, if you settle into that 80-20 mindset, you're going to be fine. I mean, the body does not require perfection. It can deal with a lot of crap.
Yeah.
And you got to live your life. People got to live their life.
But it can't deal with all crap, right? Like that doesn't work. We know that doesn't work.
Right.
And everyone's going to tell a story about someone who ate bacon every day and smoked cigarettes and drank beer and lived till 98. And God bless them. Some people do have really, really, really great genes and can tolerate that amount of toxin.
Exactly.
But most of us don't.
Yeah.
Most of us will not tolerate that amount of pollution in our lives.
Yeah. I mean, that's just, you hit the nail on the head. And going back to that's, the genetics meeting the environment, right? Not everyone that smokes gets lung cancer.
Yeah.
And some people that, don't even smoke, but are around secondhand smoke get it like that.
Yeah.
So, and you never, part of our process with the soil sample stuff is to also educate people on like, what are they going to be most predisposed for? And we have the genetic tests now where we can look at, it's not complete yet, but we know a lot of these key markers and enzymes that are involved in setting people up for cardiovascular disease or certain types of cancers or, whatever. And so, doing that deep dive, looking at nutrient levels and metabolic markers, inflammation, part of that's also looking at, what is your genome kind of look like? What is your blueprint? And what are things that you need to be a little more squeaky clean with versus your neighbor?
Yeah. Yeah.
So that's
And
part of
that's
that too.
really important testing to have, right? To know your genetics enough to nurture your nature.
Right. Right.
I know when I ran mine, I learned a lot about myself that if I was being more self aware, I probably could have figured it out. But we just don't necessarily think like that. So for years, I used to do spin. I used to go to spin class at
Mhm.
6 a.m. before I would go into work. And the days that I would spin 3 days a week. And the days that I would spin, I would be like asleep at my desk by 10 o'clock. And it was because I just don't burn my exhaust cleanly, right? So I
Yeah.
was actually toxic for hours afterwards. And my body just wanted to sleep because it wanted to detoxify,
Yeah.
because sleep is where
Sure.
our healing happens. And
100%.
it wasn't until I had my DNA run and it told me that I cannot do that high intensity stuff because I
Right.
just create too much exhaust that I
Mhm.
was like, oh, yeah, that makes so much sense.
Yeah. Yeah. We see so many light bulbs go off with patients when we connect those dots for them, and when we get the testing done, and then we say, okay, this is why, you have these, symptoms with certain things, with certain foods, with certain types of activity, like you said, or this is why you know, burn really easily in the sun, or you can't handle, a certain type of toxin very well.
Yeah.
Those light bulb moments start going off for people. And then we also connect it with, okay, this is why you're having these symptoms. This is why your other lab markers, why your vitamin D is chronically low despite taking a supplement. Well, your VDR has a mutation, and we have to adjust for that.
Yeah.
Um, your hormones, you've always had, terrible periods, and maybe you got a history of PCOS, whatever. Okay, here's the blueprint. This is the mechanism by which that's causing that when it interfaces with a certain environment. And then we help people see the full picture so that they can set up their day-to-day life to live in harmony, like you said, nurture their nature. And so it's empowering for them,
Yeah.
and this is all because they may have gotten a cancer diagnosis, and now they understand, now they actually have a user manual for their body.
Yeah. I love that. What is your go to nutrigenomic test?
I like Nutrition Genome.
Yeah.
Yeah. Yeah. That's the one I've used the most. There's a lot of good ones. I mean, that space is just, there's lots of new offerings there, but the Nutrition Genome is a pretty good one. It's fairly affordable. You get a ton of information. Sometimes people, it's too much for people.
Yeah. I mean, it is overwhelming. It is
Yeah.
overwhelming because it's like an
There's
80-page report or something
Yeah, it
along
is.
those lines.
And, there's really only, I would say, there's about 10 to 15 pages that
Yeah.
give you most of the information, and the
Yeah.
rest is just like additional if you wanted information. But, you know, again, I'm working with cancer patients, so we're doing that full, thorough look under the hood. If patients don't have cancer, or they're more worried about cardiovascular issues, there's smaller genome tests they can do just for those issues, or more of a male-based one or a female-based one.
Yeah.
So there's different ones out there, but I typically am running the full nutrition genome on people.
Yeah.
Yeah.
And I think it's a really worthwhile endeavor, whether you have cancer or not, because it does give you the information that you need to protect yourself against a variety of chronic diseases, and knowing your risks and knowing where your vulnerabilities are, but also knowing how to avoid the minefields.
Right.
I
Yeah.
mean,
Most
I
importantly,
think that that's the most valuable part, is avoiding the minefields for you.
for sure. For
Yeah.
sure. And that's, like I said, it's an out of pocket cost, but, it's something you do one time, right? You spend the three or four
One
hundred
time.
dollars for that
Yeah.
test. You do it one time. That information's static, and you can make decisions for the rest of your life based on that information.
Yeah. So, as far as those kind of indolent infections that we
Mhm.
talk about, I've been talking a lot about parasites
Yep.
and people
Big
having
one.
chronic parasitic infections. Some people feel as if that is just a normal part of our microbiome. How do you feel about that whole parasite thing?
Yeah, I mean, both can be true. There are, we do all, it's kind of gross, but we do all have parasites, it kind of in our body that are commensurate there. And so if the problem is just like with yeast or certain bacteria or certain viruses, is if they become overgrown, right? Just like, going back to the weeds in the yard, right? If you got one weed, it's probably not a big deal. But if you start getting lots of weeds, it can take over the yard. And so parasites the same way. Some parasites, can cause big problems. A lot of them don't cause many problems unless your immune system really gets, taken out. You've got, all other problems going on with your soil. You've got inflammation. You've got, don't have enough nutrients. Your hormones are all over the place. All the other things that keep those types of infection, those pathogens in their place. When all
Mm-hmm.
those other checks and balances are out, that's where you see these opportunistic infections, these stealth infections usually take over.
Yeah.
And then you got
I
to treat
just
it.
find that
You got to treat them.
almost everyone is suffering from an immune perspective these days because of the amount of stress that we all have in our lives,
Yeah.
right? We were only meant to be in that fight or flight state about 5% of the time. And most of us are in that state almost all of the
All the
time,
time.
right?
Yeah.
And so that immediately that suppresses everyone's immune system, because if you need to run away from a saber-tooth tiger, if you're eminently going to die at the mouth of a
Mm-hmm.
saber-tooth tiger, you don't need to fight off the common cold. You don't need your immune system. So many of us are switched off
Yeah.
anyway. And
Yeah.
I think that is a lot of the reason why we have so much imbalance. And then on top of it, we had something happen in 2020 and 2021 that really messed with our immunity.
Yeah. Really
And
pulled
I,
the
I
rug
think
out
that
from under
it's
us.
contributing to those numbers that we're seeing in terms
100%.
of a cancer epidemic.
100%. And I get people that are, they're active online on social media, and they want to paint the picture that like COVID and the COVID response and the fallout from COVID is like that's the only thing that caused this, right? Now, I think it's a big piece of the puzzle. I think that it certainly has been a contributor to this meteoric rise, but a lot of these things were happening. We saw this momentum and this trend coming even before COVID.
Oh,
COVID
for
just
sure.
it
For sure.
accelerated it, no doubt.
Yeah.
And not
Yeah.
only the disease, but the response to the disease, which was multifactorial. Um,
Yeah.
and then just the way the world's changed since then. We've got a lot more things to be stressed out about, right?
Yeah.
Like you
Yeah.
said, and
Absolutely.
stress is a problem. It's oftentimes the biggest X factor when I'm working with patients. We'll go through, all their soil issues, and we'll fix their nutrient levels and get their inflammation under control and their infections and everything. But what's oftentimes left for them to really deal with is getting a grip on their day-to-day stress. And if you're alive on this planet, you're not just on a secluded island somewhere. You're going to have stressors. Okay, work, family, relationships, politics, whatever you want to get. There's plenty to get stressed out about, right?
Yeah. There's no lack of things to be stressed about.
And we can't just avoid stress. So what do we got to do? We got to build routines into our day that allow us to disconnect from that stress. That's the only way to do it.
Yeah. You
Otherwise,
have to have some way of becoming stress proof and like letting it roll off of you, right? You can't sweat every single thing that comes in your field.
you got to find what works for you. Some people it's meditation and mindfulness based practices, prayer. Some people it's spending time in nature. Sometimes some people it's deep breathing exercises, journaling, art, dance, music, something that gets them into their body and out of their head. Um, but you have to build these routines. I mean, this is a must for people, because if your only way of disconnecting from stress is going and having a couple of drinks or jumping on these things, right? That's not gonna cut it.
Mm-mm.
And you're never going to disconnect from that sympathetic state, which is what keeps our nervous system in that fight or flight state, which was what, if done too long, suppresses the immune system, leaves you open to these problems like cancer, because stealth infections start roaring, inflammation levels go up, and you make yourself just more vulnerable across the board.
Yeah. And speaking of it taking time, if you wake up one day and there's a saber-tooth tiger there, and then you wake up the next day and there's a saber-tooth tiger there, and you wake up the next day and there's a saber-tooth tiger there, your body then gets conditioned to think that there's always a saber-tooth tiger there, right? We are all in that state.
Yeah.
Right? If you're on your cell phone 24/7, even when you're off it, your body still feels all of that. That's the stage that you've set. That's the soil that you have.
Exactly.
Right? So it does really take a lot of time and a lot of work in order to undo that formula.
Right.
Right?
Yeah.
And you have to believe that you're worth it.
You have to believe it. And it's hard for people, people might listen to this conversation and be like, well, I mean, that sounds great, but like, how do I actually do that? Right. Or like, do I really need to do that? What's going to work for me? Right. And I say, look, everyone's got to find what works for them. But to me, you have to try different things. And to me, it's most powerful when you are working with a physician, a doctor that understands, how does this translate into what we're seeing in your labs, in your soil? Because people are going to be most motivated when they know that there's something in their labs that is connecting the stress. They're going to be much more motivated to deal with their stressors when they see that connection with, hey, in your body, this is what's going on because of these stressors you're dealing with. And if you don't get a grip on this, these are going to get worse. And that's why we can't get maybe these inflammation markers under control, or we can't get your immune system where we need to get it, is because of the stress.
Yeah.
And so that's
and
why
that also spills over into your metabolic system too.
100%.
Yeah.
100%. Yeah. Because the cells, when we talk about metabolic health, right, it's become kind of a buzzword, right? But what are we actually talking about? We're talking about the metabolism of your cells. Okay. And this is where we can geek out on the Krebs cycle and mitochondria and all these, but how do your cells make energy and how do they function? Are they functionally in a healthy metabolic state, or are they in a reverted to maybe a low energy state, like fermenting cells, which is oftentimes a precursor to a cancer cell? And this starts in the mitochondria. So mitochondria, metabolic, those words can kind of go hand in hand, but it all comes down to what damages the mitochondria's ability to produce enough energy so that cell runs correctly, that cell cycle operates correctly, and it doesn't turn into a bad cell or a cancer cell. What are the biggest mitochondrial disruptors? Toxins, infections, inflammation. Okay. So when we look at root causes of cancer, it really comes down to mitochondrial disruptors. And so people have told me, have heard me talk about what I feel are the three biggest root causes to cancer is chronic inflammation, chronic toxicities, and chronic infections. Because those are the three categories of things that mess with your mitochondria, force them into a low energy state, which then sets them up to go down that road of becoming a cancerous cell. That's the only way they can survive.
Yeah.
The cell's doing what the cell's supposed to do. It's surviving in a very unhealthy environment.
Yeah. Yeah. I always say cancer is a normal response to an abnormal environment.
Exactly.
And you're never going to solve the problem unless you figure out what is making the environment abnormal. And in the conventional cancer world, the thinking is that it's the tumor making the microenvironment abnormal. But It's actually the tumor happened because the microenvironment was abnormal.
Right.
And this is part and parcel to the reason why we don't see the results that we want to see from the conventional medical approach,
Right.
right? No one gets healthier if all you do is have a surgery and have radiation and have chemotherapy.
Right.
Quite the contrary. You're
I was going
you're
to say,
less
it
you're
usually goes
less
the other way.
healthy as a result, right? Um,
Yeah.
but that our system doesn't really value health, and
Well, we got,
that is
yeah,
a major problem.
that's got to change. And there's more and more doctors that I think are realizing that and waking up. And so, I don't want to paint too much of a doom and gloom picture. I think we're getting there. And I think that, one of the silver linings of all this awareness around cancer and the epidemics and all this is that a lot of doctors are waking up, and strength in numbers. And, it's going to reach a tipping point, I think, at some level, because the patients, I think, have been really the initial drivers in the demand of this. But now the doctors are getting on board, and you're seeing more and more integrative clinics and even hospital systems that are, hopefully coming in the not too distant future. And so, we're going to get there. It's too slow. Let's admit it. It's too slow,
Yeah,
but I think we're going to get there.
yeah. And I agree with you. I wish that it were happening faster. I wish that it were happening on a more broad scale. I still have patients who are not telling their medical oncologist the truth because their medical oncologists are telling them, what you eat doesn't matter. And that feels really offensive to them, especially when they're working so hard
Yeah.
to eat in a way that's nourishing. They're not supportive in fasting when we know from the work of Dr. Walter Longo that if you are going to get chemotherapy, and I am not entirely against chemotherapy, so I want to be out there and say that if your proverbial sink is overflowing, if you have significant tumor burden and you need a quick fix, which is what chemotherapy is, and we
Mm-hmm.
know that about 10% of people who get chemotherapy will have benefit, right? So we're looking for that 8 or 10% that are really going to have benefit. But if that's you and you believe in your heart that chemotherapy will help you, because that is the other necessary piece. Like, don't undergo chemotherapy if you don't think it's going to work, because I can promise you it's not going to work if you don't think it's going to work.
Yeah.
But we know that there is a greater effect with less side effects if you fast through chemotherapy. We
Yeah.
know that from Dr. Walter Longo's work at USC. And
Well,
yet, how many medical oncologists are talking to their patients about the fasting mimicking diet?
they're not, and they won't, because guess what? They're not being told to do that. They're not being
Yeah.
told by their societies and their journals and all these things that set the standard for how medical oncologists practice. They have a very strict set of guidelines, and they to a fault. They're nothing if not consistent. They stick to that damn script.
Yeah. Yeah.
For better or
And
worse, they stick to
and
it,
for
and
some extent, because they have to,
they
right?
have
Because
to.
this is the
Yeah,
study, this is what the study said, and so they're going to follow study guidelines. And people don't realize that so many of those guidelines that are set forth by the study, they're randomly chosen,
yeah,
right?
yeah.
Like,
Well,
in terms of Herceptin for HER2 positive disease, they just chose a
yeah,
year. It
yep,
doesn't mean that 6 months wouldn't work. They just didn't trial 6 months.
yeah,
Or conversely, with Herceptin, they trialed it along with other chemotherapeutic drugs. It doesn't mean it wouldn't work alone. They just didn't trial it,
yeah.
right?
Herceptin's. The data around Herceptin, the data around Avastin is, people actually go and look at these drugs, and you can argue the research and the methods and material, all that, and how they were set up, and maybe conflicts of interest when it came to funding. But at the end of the day, even with all of that finagling going on in the research world, we have drugs that are getting approved to treat cancer based on extending life by 2 months.
I know.
And these drug companies are making billions off of
Billions.
drugs that have been shown on average to extend someone's life 2 months.
And it's a miserable 2 months. It's
It's
not 2 months
oftentimes a
of
miserable,
life. It's two
absolutely.
months of misery.
Yeah. But they're going to
Um,
extract the rest, as much money from you in that last 2 months as they can.
yeah. Yeah.
Uh,
And
all based on this hope that you're that 1 in 200 patients that has some sort of miracle response to it.
yeah, which I would probably argue that it has nothing to do with the
The drug.
chemotherapy and has a lot to do with all the other things.
Right.
And it's because most of these drugs, the clinical trials are not designed to show an improvement in survival. They have these surrogate endpoints like response to
Disease-free survival,
treatment or
progression-free
disease,
survival.
yes, progression-free survival.
Yeah. Yeah.
And that does not translate into overall survival. And
No.
yet people get entered into studies or agree to take these medications and they don't know about that.
No.
Like we
No.
talk about informed consent, but I really don't think that that's happening. I mean, that's part of the reason why I wrote my book, The Smart
Well,
Woman's Guide to Breast Cancer, because people do not have the opportunity to make an informed decision because they're not being given the real facts.
and look, these are complex topics. I mean, even for people like you and I who have been swimming in this type of stuff and have training and know how to read research and understand what's going on behind the scenes, it's still at the end of the day, it's a complex conversation
Yeah.
to actually consent someone on risks and benefits of these types of treatments. And you can't do it in these 5-minute medical models that we have now. So you're right. That's a big problem. I think a lot of people in hindsight, I hear this from patients all the time. I wish I wouldn't have done that treatment, or I wish I wouldn't have agreed to do this. And I wish I would have been a little more, I wish I would have advocated for myself a little more and sought other opinions before I just jumped into what my medical oncologist said I better do, or else I'm going to die in 6 months.
Yeah. Well,
And they
and
use
so
that
many
tactic a
people,
lot.
yeah. And people make so many decisions out of fear and desperation.
100%.
Yeah.
100%. And it's too bad. It's unfortunate. Yes, cancer can kill you. Yes, it's something you need to take seriously. But I tell everybody that there's always time to get additional opinions. Okay.
Always.
Unless you're
I
in the
mean,
hospital and like you've got an obstructing tumor somewhere, or
yeah,
you have brain bleed from a tumor in your head or something like that. If you're at home and you're eating and walking around on your own, you've got time to get another opinion.
100%. Absolutely. I think that if you hear nothing else, hear that.
Yeah.
That unless you have some emergent situation in the world of breast cancer, I talk about three things. I talk about inflammatory breast cancer because it is so rapidly progressive, and that is something that needs immediate intervention. I talk about if you have a pathologic fracture. So if you have metastasis to your bones that has caused a fracture and you're in a tremendous amount of pain, it's impossible to heal when you're in pain. So that is something that needs
Sure.
immediate intervention. And the third thing is if you have brain mets, because our skull is a fixed space
Yes.
and there's a lot of swelling involved with brain metastasis. So if that is the case, yes, you need immediate intervention. And everyone else, you have time.
You have
Take a
time.
breath,
You
take
have
a
time.
pause. Yeah,
Yeah.
educate yourself.
Yeah.
So I know that you have worked at the finest integrative oncology clinics in the world. I would love to hear some insight about what happens there that's different and what is new on the horizon in the integrative medicine space that is going to make a difference in the cancer world.
Yeah. I mean, what works, like you said, I've worked at a lot of different hospitals and clinics and places that were uh, cutting edge for their time when I was there. The integrative oncology is, in contrast to mainstream medicine, I'd say it's a very quickly evolving space. And there's always new stuff coming down the pipe that we're which is really exciting, but it's also like, you know, the protocols I used last year are already kind of out of date. Like I got to update, you know, what I'm doing.
Yeah. I
But
always
I mean,
say if you're not embarrassed about something that you did 6 months ago, you are not learning.
right, right. So I really try to take my ongoing learning and education, you know, pretty seriously, and keep up to speed with everything, because there's people all around the world that are doing really cool things. Everything from, you know, IV therapies, like things like IV nutrients, right? That's something that a lot of patients come to integrative oncologists for. IV vitamin C, IV alpha lipoic acid, IV methylene blue, IV glutathione. I mean, there's so many nutrients that we can do in a high dose intravenous fashion that bypass what you would get just taking them orally, and can really create a shift in the body much quicker, especially with someone where that timeline sped up a little bit when they have a cancer diagnosis. You know, we're doing a lot of more now than a couple of years ago. I'm doing a ton of detox with patients, you know, not only detoxing them from their chronic toxicities, but then also detoxing them from some of the treatments they've been through, some of the conventional treatments.
Well, that's an important part, right? I mean, people
It
ask
is.
me all the time, how do I recover from radiation?
Right.
I would love to address that a little bit. How do I recover from radiation? How do I recover from chemotherapy? Because
Right.
these are really important questions that people are asking all the time.
Yeah, they are. And, you know, they're not getting answers from the other side, obviously.
No.
And
Yeah.
so, you know, there's a time and a place for detox. You need to be, you know, you need to know what toxin you're dealing with, and what the constitution of the patient is. Make sure that their body is ready to handle a detox, and then utilize the right protocols based on that. And, you know, when patients are in active treatment, you know, that's typically not when we're detoxing them,
Right.
but
Of
usually
course.
there are spaces and breaks where we can devote some time to that. Even just in a couple of weeks, you can get a lot of crap out of people if you're doing the right things. So there's a time and a place for that. I'm doing that a ton with patients. We're working on their immune system. You know, mistletoe is one of my favorite therapies to help patients' immune systems sort of restore the factory settings, is what I call it, because we do have a portion of our immune system that is designed to deal with cancer. But when we see these patients that have a cancer problem, for some reason that program is not running correctly. Their immune system's either you know, dealing with another problem, or confused, or they're not producing enough natural killer cells, or whatever it is. And we still have to address those other problems. But in the meantime, we can get their immune system working again with therapies like mistletoe, therapies like Helleborus. These
So
are
are you
considered
using
alternative
subcutaneous
therapies.
injections for mistletoe? Is that what you're doing?
Subcutaneous.
Mm-hmm.
Yeah, I mean, 95% of mistletoe is typically done subcutaneously. There are protocols to do it IV, and even some intratumoral injection protocols out there, but 95% of the time, the subcutaneous injections are what most patients need to do.
Mm-hmm.
And it's very simple. These are self-injections, like a diabetic gives themselves an insulin shot.
Yeah.
So, and these are therapies, you know, mistletoe specifically. You go to at least half of the European countries, and they're doing this as part of their standard of care.
I know.
They have
There's
been for
so
years.
much that's happening in Europe or internationally that is standard of care that we don't even begin to address here, or we are so afraid of it. You know, so many of my patients are on supplements that they can't tell their medical oncologist about because the
Right.
medical oncologist would say no.
Yeah. Or they send them to the pharmacist, and the pharmacist finds some obscure reference of why there's a nutrient drug interaction.
Yeah.
So yeah, I mean, it's way easier for them, for patients not to do all that stuff, right? Because then they don't have to deal with it, because they don't really know what to do with that stuff.
Yeah.
But if we have a truly collaborative and integrative approach with the medical oncologist being a piece of that team, but also other integrative practitioners, then guess what? The medical oncologist says, you know what? you need to go talk to Dr. Lucas. He deals with that stuff. Just like I would say, oh, you need chemo? Go talk to this guy. I don't do that.
Yeah.
You need surgery? Go talk to Dr. Simmons. Whatever. So we all have our role. I know you don't do that anymore, but the point is
taken.
that the point is that instead of just telling patients, don't do mistletoe, don't do IVC, don't take supplements, diet doesn't matter, send them to people that know what they're talking about.
Yeah. I say all the time, I think that what's happening is instead of saying, I don't know, they say no. And it's because we're kind of trained along this paradigm that we're not allowed to not know, right? It's embarrassing or makes us inferior or whatever it is, whatever that fear is, they say no when they don't know. Yeah. And it's such a shame that we can't be vulnerable and say, I mean, I say this all the time, like, I don't know, but I guarantee you I'm going to figure it out. Right? Like, I'm going to do my damnedest to get a real answer to that.
Let's find somebody that knows the answer to that.
Yeah.
Already. Yeah.
Okay. So you like mistletoe for immune stimulants. I get this question all the time. What else are what are your other go-to things to help people to improve their immunity? I mean, obviously you need to remove whatever is suppressing their immunity, right? So I talk to people a lot about what's happening in their mouth and going to have a cone beam CT to make sure that they don't have cavitations and chronic infections.
Absolutely.
Getting the mercury out of their mouth because that is an immune suppressant.
Yeah. Well, being a breast cancer specialist, I mean, there's such a huge connection between dental issues and breast cancer. And I've seen that in my practice. I think anybody that's out there in the integrative world would agree with that. More so than other types of cancer. I think we're seeing it in
thyroid disease too.
Head and neck as well. You're right. Absolutely. You gotta address what's creating the immune dysfunction or immune suppression. The mistletoe is great, but ultimately long term, we want to address the root cause of that dysfunction. And so that's usually a chronic infection, whether it's in the mouth or somewhere else. That we talked about stress and its impact on your immune system, other toxins. Mold is one of the huge toxin issues we see in our cancer patients. And it's a double whammy because it not only can cause cancer, it suppresses the immune system. Most of your immune suppressant drugs are made from mold. Okay. Mycophenolate, cyclosporin, these are all, mold is the great immune suppressor.
Yeah. Yeah.
And a lot of people are chock full of mold and have no idea.
Yeah. Mycophenolate is a drug that we actually use in transplant patients
when you don't want them to overreact to a new tissue. Exactly.
Yeah.
So these are mold toxins that people breathe in when they've got water damage in their home or office. And it can be 20 years ago. These things can still be in your body.
Yeah.
And you've got some people going back to the connection of the genetics and the environment. Some people genetically are ill prepared to deal with mold. They get exposed to very little and it causes a major problem. Whereas other people, they live in a mold home their whole life. It doesn't cause a problem. Their body's able to deal with it.
Yeah. I mean, I had that issue in my house where, I'm living with 3 other people and I'm the only one that's sick.
Yeah.
And, my husband's like, oh, we're fine. Everyone's fine. It's only you. It can't be the house. And I'm like, it's definitely the house. Definitely the house.
Yeah.
We talked about mold and mycotoxins at one end of the spectrum. What about medicinal mushrooms on the other end of the spectrum?
Oh, yeah. Yeah. I mean, to stay with the topic of, how to get the immune system working well, medicinal mushrooms are wonderful. And there's so many now too. Turkey tail and cordyceps and reishi, maitake. There were some great studies that came out recently with maitake. Not only showing the immune support, but also showing direct cytotoxicity to a lot of cancer cells. So these things are very exciting. again, you go to other parts of the world and they're used more regularly than we find here. Japan is huge. They do a ton of
Absolutely.
medicinal mushroom treatments with cancer patients over there, combining them with, medications and stuff. And so
Yeah, they're almost always part of cancer protocols.
always, always. Yeah. And
Yeah.
just like mistletoe, you go to Germany or Switzerland, they're like, okay, we realize that the immune system, we need to strengthen the immune system. While we work on I'm not saying they're not giving the patients chemo too, but they're at least also supporting the immune system along the way.
Yeah, absolutely. And I'm also using a lot of low dose naltrexone. How about you?
Oh, love low dose naltrexone. LDN, as most people will hear it phrased as, but that's such a it can be such a game changer for people, especially if they have any history of any autoimmune diseases. I always run an ANA screen on my patients as part of that soil test. Because it can help with selecting the right type of mistletoe for them. But B, if they have a positive ANA, even if they don't have a full-blown autoimmune disease, if they've never been diagnosed with one, low-dose naltrexone is the first thing I'll put them on.
Yeah, amazing.
You got Hashimoto's, you got Crohn's, colitis, anything like that going on.
Yeah.
LDN, I've seen LDN single-handedly reverse autoimmune disease.
Yeah, it's really amazing. It's really amazing the impact that it has.
Powerful.
And it's equally as amazing to me that hasn't crossed over.
Well, yeah, I mean the research. If you go to, remember the website is, but it's like, I think it's like LDN Research Trust, but it's like a database for all the. I mean, the research is astounding.
Astounding.
You can't
And
act
yet,
like the research isn't there for it.
Yeah.
And so, but the practice,
and yet,
yeah.
autoimmune thyroiditis is so common, and these people are not being put on LDN.
No, very few rheumatologists or conventional doctors even know what that is.
Yeah.
They see naltrexone and they're like, why are you taking this? Like that, because usually it's used as a kind of like Narcan, right? For like people that have either an overdose or withdrawals from opiates.
Yeah.
Seen as like a rescue drug, but low doses, guess what? It does something very different in the body. You start releasing endorphins, particularly in your gut. That gets things moving in the right, and that calms down your immune system. So when you've got an overactive immune system and you start sending these endorphin signals in the gut, which is where the immune system really nests, it just calms it down. It calms it down and it can break that cycle, because oftentimes autoimmune disease is just your immune system is just caught in a bad cycle.
Yeah.
Yeah.
Yeah. I had a patient with metastatic breast cancer who has been stable for years and years and years, and her son is a physician. And when I suggested that she go on low dose naltrexone, her son was just adamantly against it. He's like, "You're not an opioid user," and
Yeah, right.
and there's just no education around it in a conventional medical space.
No, because guess what? It's cheap.
Yeah. Yeah. Yeah.
So
it's not worth anyone's while.
Who's going to sink money into to market it and bring it to the physicians at these different conferences and say, oh, you need to be doing this because we're going to make money off it. Well,
yeah,
it's like oftentimes what we see with some of these off-label drugs, right? Like ivermectin, right? You see that same thing play out.
Oh yeah.
Cheap drug that's effective. Get this thing out of here.
Yeah. I mean, listen,
this
people
is a threat.
Lost their medical licenses over that.
Over a drug that you should be able to buy over the counter.
Yeah. Yeah. A drug that we have, I mean, decades of safety profiles on. Decades.
Yeah. Actually, a lot of cancer research too, believe it or not.
Yeah.
A lot of cancer doctors stumbled upon ivermectin based on what happened through COVID. And it's like, oh gosh, we've got studies going back 20 years showing this thing helps with triple negative breast cancer, bladder cancer, kidney cancer. I mean, the research is actually pretty amazing.
Yeah.
And we never knew about it, really.
Well, This has been an amazing conversation. I think we're going to have you back for a part 2. But in the meantime,
Yeah.
where can people find you if they want to learn more from you?
Yeah, I'm actively, accepting patients. I'm working right now strictly telemedicine, so I can pretty much work with patients all around the country, all around the world, as long as you got an internet connection and we get you set up. But yeah, I'm working exclusively with cancer patients, and you can book consults with me through my website, which is www.drlucas.org. Doctor spelled out. I'm also pretty active on social media, particularly Instagram. Patients or people sometimes reach out to me through there. That's totally fine as well. And I'm working on some next chapter things that I'm looking forward to share with people here probably in the next 6 months. So stay tuned for that as well.
Well, when you're ready for your next chapter things, I would love to have you back.
Yes.
And in the meantime, I thank you so much for your time, for sharing your wisdom. I know that you have a breadth of experience in this space and you are really making a difference in the world of integrative oncology. And we need this now more than ever. So thank you so much for your time and for everything that you do.
Oh, amazing. Thank you so much for having me.
My pleasure. And if you liked this episode, if you know someone that needs to hear this episode, please like it, share it, send us a comment, send us a question. We're happy to address that for you. And I will be back next week, same time, same place. It's Dr. Jenn. Bye for now.